Good evening. This is Gabby with your CBU 5 News. Tonight we will be discussing breaking news in the healthcare system. Now off to Jeanette with our local news.
Welcome to CBU Channel 5 News. On our local news today, 2 children have lost their life in our inland counties due to influenza. Riverside and San Bernardino County are warning individuals about the peak flu months, which are January and February. Doctors are informing the public that it is not too late to get your influenza shot. This information is of great importance to the healthcare workers because it allows them to prepare the ER for the influx of patients. Don't forget hand hygiene.
In national news, the Affordable Health Care Act implemented by our previous president, Barack Obama, is faced with an uncertain future now that President Donald Trump has been elected into office. Millions of Americans who rely on this act for insurance are now at risk for losing their coverage. Americans are still encouraged to apply because it is unsure how long until this change will take effect or go through at all. How does this affect nursing? Without a suitable solution in place, less people will have access to health insurance, and this could lead to the hospital being faced with the bill and could lead to jobs being cut. There is a possibility President Trump has a new program ready to be implemented that will better the future for patients and nurses, but we will have to continue to watch this story.
Now on to global news. In January, there were over 300 medications added to a list that will help pay for by the government for multiple diseases in China. This includes cancer, hepatitis, kidney disease, and hemophilia. This is a big advancement because this list has not been updated for 7 years. Since 2009, patients have been paying out of pocket for many oncology drugs that have sent patients into spiraling debts. By expanding this list by 300 medications, this increases sales globally through pharmaceutical companies. Adding these medications affects nursing all around the world because global pharmaceutical companies are going to have their drugs on the national reimbursement list. Nurses will need to know which new drugs are available to patients at partial cost so they can advocate for their patients. And that's a wrap for the CBU 5 News. Have a good evening.